Hello, this is Angelia, and you're listening to or watching the podcast, Why You Do What You Do, the podcast that talks about human development and psychology to maybe help you figure out a little bit more about why you do what you do. And we've been talking about limitations of the field, and we're going to now switch over to talking about issues in the field. As our society changes, certain behaviors can glide in and out of the abnormal category, and we know that, from the past. If you look at the beginning of psychology back in, 1800s and things, there were several things that were considered, abnormal. They're now considered within the scope of normal. Therefore, the nature of any single act is hard to pinpoint as essentially normal or abnormal. And that's, behavior in general. That's not severity of symptoms. Perhaps the most dramatic example is the conflict over homosexuality. Reflecting the dominant view in this country, the American Psychiatric Association's Diagnostic and Statistical Manual, or the DSM, some of y'all know what the DSM is. I forget what version we're on now, but it's the little book that your mental health professional will be thumbing through to look for a nice little code to say this is what you got. For years classified homosexuality as a disorder, and that's because the pressure of society said it was. But as a growing segment of society came to dispute this view, the association voted to delete homosexuality from its list, because again, if it happens in nature, it's natural, and there are enough people, like I said, it's not the average, it's not the norm, it's not the tip of the bell curve, it's over that way, but there's still enough people that it is considered a norm. Now you might not agree with that, but that's just a fact. This move did not by any means end the controversy, however. As we know, it is still going on today. And that's because there's people living in Leviticus, like I keep telling you, you're not supposed to be doing. Is abnormality a false concept? Theorists such as R.D. Laing argue that abnormal behavior is actually a rational response to an irrational society. And there was a woman who I was partnering with on some stuff, and she said something that I thought it was a really good statement, and it was people having normal reactions to abnormal situations. And I thought that was a good one. In a world that is contradictory and confusing, we should not be surprised that some people choose to create an alternative reality. There are folks out there doing that. Nor do we have any good reason to view their reality as less valid than ours. The prevailing opinion in abnormal psychology is that disorders do exist. The historical record alone is enough to convince most observers. And, only people who are ignorant don't believe that mental illness is a thing. Laing and others do raise some important points, though. One is that it is dangerous simply to regard any view that conflicts with the social consensus as an indication of insanity. And that's kind of a problem that we're starting to have now. There's a certain section of the population who thinks that consensus should be the rule of law here, and if you disagree with them, then you're not a good person, you're crazy, whatever. And that's just not true. Everybody has their own opinion, there's a saying, but I won't say it. Just because someone disagrees with you doesn't mean they're crazy. And it doesn't mean they don't have a valid way of life or valid opinions. So you need to grow up and accept that. The Soviet practice of branding political dissidents mentally ill is an extreme example, and I wonder who's trying to do that nowadays. But the problem has existed for centuries. and it's still going on today. If you don't agree with some of the powers that be, you got a problem. You're not okay. You're mentally ill. You're crazy. You bad. Whatever label they want to throw on it, but that doesn't make it so. A classic case is Joan of Arc, who was executed for the heresy of hearing voices that told her she could lead the army of France to victory over the British. Of course, the charge of heresy was not made until she proved her point with decisive action, and it was her pro-British Burgundian captors who denounced her and burned her at the stake. So she did exactly what the voices told her to do, and she won, but the opposition wasn't too fond of that, and so they put her to death. Probably, because it interfered with their pocket would be my guess. Another point is that disordered behavior is not necessarily without logic, and that's the case as in OCD. You develop that behavior for a reason. It was comforting. It helped you make sense of your world. It helped you know for sure that you did things right a certain way. So sometimes there's some form of logic. Maladaptive behaviors are a form of logic in your own brain. It's not really helpful. And eventually we all outgrow them. Now there's a problem when some people don't outgrow them and it becomes an impediment in their life. And then they usually go to talk to somebody and stop that. The alternative really created by some schizophrenics, for example, is rich, detailed, and internally coherent. So it makes sense to them. We might be like, but it makes sense to them. However, it is usually a source of unimaginable torment to the schizophrenic. And that's how you know the difference. If a person is perfectly happy, then for them it's not a problem. But if it's tormenting them, if it's a problem for them, then it's usually a problem. Now there are cases at the far end of the spectrum where you have, sociopaths, psychopaths, where their deviant behavior is definitely not a problem with them. They could be, like Jeffrey Dahmer, and he didn't have a problem with what he was doing. He was perfectly fine with it. So, As we mentioned earlier, the current practice is to classify a behavior pattern as disordered not merely when it is different, but when it causes anguish to the individual or to others who try to deal with the problem. As I said, if you're a danger to yourself and others. Does abnormality serve a purpose? Some observers have suggested that the strange behavior of the few may be a valuable lesson to the rest of us. Perhaps individuals who flout societal norms are actually reinforcing those norms by dramatizing the consequences of right and wrong behavior. Because we all know the story about, if your friends jumped off a bridge, would you do it too? Every parent, I think, throws that one out there. With the point of, someone did it and they died, so, it's a lesson. According to this view, disturbed people become much like the exotic freaks that perform in the sideshow of a circus. They are the bag ladies, drunks, and other weirdos that we observe with curiosity and amusement, secretly relieved that even a little proud that we aren't like that. And, that's a general statement there. It's for some folks. It's not, you're supposed to have compassion and understanding for folks. So, that's just how they put it in the book. Don't think that's what I'm saying, is that you're supposed to be amused at them. That's not right. Indeed, it has been suggested that people who feel threatened rather than amused or compassionate, when they encounter deviant behavior, may be showing a lack of confidence in their own normality. So people who react pretty strongly to other people's behavior might think, the macho man who loudly insists that he hates faggots is a classic example. His real concern may be a fear that he, too, can be attracted to other men. The Methinks you protest too strongly. The behavior continuum. Arnold is visibly different from the rest of us. But what about Elaine? Her husband believes she is just suffering from a temporary depression. No need for professional help. If we noticed Arnold lifting his pants leg to check on his white socks, we might laugh at his odd behavior. But if we looked in through Elaine's kitchen window, we probably would not be amused. Elaine could too easily be the woman next door, or Aunt Helen, or even Mom. The contrast between Arnold and Elaine raises a major question in abnormal psychology. Is the difference between normal and abnormal behavior a difference in kind or in degree? And the answer is it could be both. That is, are psychological disorders just an extreme form of the eccentricities all of us have, or is there a fundamental difference between the disordered person and the normal one? And sometimes no, sometimes yes. If we believe there is such a gap, then we must expect to find fundamental differences in the mental and or physiological processes underlying these two sets of behaviors. In contrast, if normal and abnormal are more accurately viewed as different positions on a continuum of behavior, then we can apply our understanding of normal behavior toward explaining the not so normal. One way of answering this question is by working backward, looking first at what is considered normal. Most disorders, we find, do seem to fit with the same models psychologists use to explain normal behavior. For example, the mood swings that most of us experience are similar to the mood swings of manic depression, though far less extreme. Also, in support of the continuum theory, is the fact that many of the symptoms of psychological disorder can be produced experimentally in otherwise normal people. It could be stress, drugs, different things. So, never say, I could never be like that, or I could never, do that, because you might be able to. For example, the loss of sensation that characterizes the conversion disorder can be produced in hypnosis. Similarly, hallucinations and depersonalization are common experiences for those who take certain drugs, such as LSD. And these symptoms are like those in schizophrenia and sociopathy. So, drugs can have you acting out behaviors that are in common with these people who are mentally ill. While we do not fully understand the mechanisms that cause these symptoms, the fact that they occur both on their own and in the laboratory suggests that they are variations of normal behavior rather than unique to psychopathology. The prevailing view among psychologists is that psychological disorders are best seen as falling at one end of a continuum of behavior, with positive mental health at the other end. So kind of like your bell curve, most of us fall in the middle somewhere, and then you have the really confident people with lots of self-esteem at the high end, and then you have the people who have serious mental problems at the low end. We can move step by step along this continuum from severe mental disturbance to limited personal distress to complete emotional satisfaction. And that's a rare person that has that. Among the milder forms of disturbance might be the fear of flying that hampers an executive's travel schedule, the severe shyness that socially restricts a college student, the compulsion of a woman to wash her hands several times a day. Closer to the positive end is where most of us fall, though we tend to shift back and forth on the scale. Sometimes shy or fearful, sometimes happy and confident. And that's where I'm going to leave you for today. I hope that helped you figure out maybe a little bit more about why you do what you do. Please like and share this educational program. And that's what it is, an educational program. It's not designed to diagnose or treat any mental illness. If anything I said in this program triggered you or made you think maybe you have a problem, then by all means, talk to your mental health professional. If you want to help me out, subscribe to my YouTube channel. If you want to help me out even more, go to my Patreon page, become a patron. Thanks for watching or listening. That's all for now. Until next time.